Hello, this is Amy Casares, and these are my synthesized findings on my research on folate receptor autoimmunity in its effects in pregnancy. The first study is called Gene Variants in the Folate Pathways are associated with increased levels of folate receptor autoantibodies. This was a general linear model and used stratified analysis to assess if there was an association between gene mutations such as MTHFR and folate receptor antibodies. After recruiting 302 pregnant women, 99 with neural tube defects, and 203 without congenital malformations, in-person interviews were done and maternal venous blood was collected at the time of delivery. The blood was genotyped and measurement of antibodies was taken for comparison. The findings for the study is that those with gene variations MTHFR, DNMT3A, and MTHFD2 gene mutations had significantly elevated plasma levels of folate receptor autoantibodies. Given that an approximate 1/3 of the U.S. has at least one of these gene mutations, this can mean a large majority of mothers are greatly at risk for adverse outcomes associated with low folate levels and folate receptor autoantibodies. Next one is cerebral folate receptor autoantibodies in autism spectrum disorder. This study used a one-tailed Mann-Whitney U non-parametric test to compare treatment and control groups. Parametric t-tests computed for comparisons and regression analysis to see if the findings were associated with folate receptor antibody concentrations or other factors such as age. This study used 93 children which had previously been diagnosed with autism spectrum disorder, including 26 who were folate receptor antibody positive. Children were given daily folinic acid supplementation, and after 1 month, the parents were asked to fill out a survey on any improvements seen in their children. The study found that improvement ratings were higher for verbal communication, receptive and expressive language, attention, and stereotypical behavior in treated versus non-treated children, suggesting that folinic acid may prove to be a beneficial treatment for those with folate receptor autoimmunity. The last is titled Prevention of Behavioral Deficits in Rats Exposed to Folate Receptor Autoantibodies, Implications in Autism. This was a pilot study. In this study, they impregnated groups of rats and exposed each group to folate receptor antibodies during gestation, pre-weaning, and post-weaning phases. All the rats were fed a normal diet which contained folic acid. Then each group of rats went through a series of timed behavioral tests, and the results were blindly observed and recorded. The group most severely affected was the group exposed during both gestation and pre-weaning, which suggests that fetal neurological development may be negatively impacted when exposed to folate receptor antibodies during times of crucial development. And these are the sources for the studies. Thank you.